The human papilloma virus, or HPV, is super common. Lots of people get it at some point in their lives. Even though it's common, whether or not to treat HPV is something doctors still talk about. Some doctors, especially those who know a lot about hormones, think treating HPV isn't always needed. They think it can make people feel bad, especially if their cervix is healthy and their tests are normal. They think this way because HPV often goes away on its own, especially in younger people with strong immune systems. But other doctors think we should treat HPV right away. They know HPV can go away on its own, but they worry about what might happen if it doesn't. They're concerned that HPV might stick around and cause bigger problems, like changes in the cervix that could lead to cervical cancer. These different opinions show just how tricky HPV is and why it's important for doctors and patients to talk about it. Let's say a young woman with a healthy cervix and good test results finds out she has HPV for the first time. Doctors don't always start treatment right away. Often they'll wait and see what happens. They'll keep a close eye on things, hoping the virus will go away on its own. This is because our bodies are pretty good at fighting off viruses, especially if we're healthy. But wait and see doesn't mean doing nothing. Regular checkups are really important. These checkups usually include a normal exam to make sure there aren't any hidden problems that could stop the body from fighting off the virus. This careful watching lets doctors step in quickly if things change or if the virus isn't going away like it should. Watching and waiting is often the first step with HPV. But sometimes treatment is really important. One big reason is the viral load. How much of the virus is in the body? If there's a lot of virus, it's more likely to stick around and cause problems, so treatment becomes more important. Treatment is also needed if there are changes in the cervix. These changes, which doctors often find during regular checkups, could mean a higher chance of cervical cancer. In these cases, treatment isn't just about getting rid of the virus, it's about stopping those serious cervix changes. Finding and treating these precancerous changes early is super important for stopping cervical cancer. It's always easier to prevent cancer than to treat it. Fighting HPV isn't always easy. Right now, there's no single treatment that gets rid of HPV every single time. This is because HPV is a tricky virus and it can sometimes hide from even the best treatments. But that doesn't mean treatment is pointless. Many people who get treated for HPV do get rid of it completely. Successful treatment often involves doing a few things. Doctors often use medicines like antivirals and interferons to help the body fight the virus. But these medicines work best when combined with a healthy lifestyle. Eating healthy foods like fruits, vegetables, and whole grains, exercising regularly, and finding ways to relax like yoga or meditation are all really important. These healthy habits make your immune system stronger so it can fight the virus better. To subscribe to more stories on this channel, please click on the subscribe link as it's free to do so. We love to share more as we can see that around the world people have the same health concerns.